Hello everyone, my name is Nana, and today I'll be talking about a very important medication that is commonly used in many hospitals known as heparin. Alright, we're going to be starting on the objectives. So we're going to try to know the definition of heparin, drug classification, generic and brand name, indication of drug use, mechanism of action, basically how the drug works in the body, contraindication, which explains like the harm heparin could cause to a patient health if they take the drugs. Common dosage and routes, explain the pharmacokinetics of the drug, being able to identify major side effects or adverse effects of heparin. Drug or food interactions. We're gonna try to understand the antidotes for heparin. Also, I'm going to be explaining nursing consideration, nursing diagnosis and intervention. And then the most fun part of it all, we're going to have a question, an NCLEX question, to know like if you really know your information very well. So like this slide actually define what heparin is. So it basically like talks about the definition of heparin. So like what is heparin? Heparin is an anticoagulant that prevents the formation of blood clots. Heparin is used to treat blood clot caused by certain medical condition or medical procedures such as venous thrombosis, pulmonary embolism, and coronary artery clot. It may also be used to prevent blood clot during dialysis, surgery and post-operative period, during blood transfusion, when collecting blood samples, or when a person is unable to move or immobile for a long time. Heparin is actually obtained from the lungs or intestinal mucosa of pigs. This slide talks about drug classification, basically the classification of heparin. How is heparin classified? Heparin is classified as an anticoagulant or antithrombotic, meaning it's a blood thinner which helps keep the blood thin enough to treat and prevent blood clot from forming in a patient's body. So in terms of anti-thrombotic, it basically means it reduces the formation of blood clot and treat dangerous blood clot that might cause a lot of complications to a patient's health. What is the generic and brand name of heparin? Could you guess? Well, you might guess right. The generic and brand name of heparin is just heparin. Isn't that easy? Our next slide talks about the indications of drug use. So basically, what is heparin really used for? Heparin can be used as a prophylaxis and a treatment of various thrombotic disorders such as venous thromboembolism, pulmonary emboli, arterial fibrillation, acute and chronic consumption of coagulopathies, deep vein thrombosis, which is known as DVT, embolic stroke, and also heparin can be used to treat acute myocardial infarction. This slide talks about the mechanism of action. How does heparin really works in the body? The job of heparin is that it turns off the coagulation pathway and prevents clot from forming or happening. Heparin works with a substance known as antithrombin 3. Antithrombin 3 is a natural inhibitor of thrombin in the blood that helps turn off three main activating factors, which are factor 2, thrombin, activator factor 10, and activator factor 9. Heparin yields its foremost anticoagulant results by deactivating thrombin and activated factor 10 or 10A through the antithrombin dependent mechanism. Heparin binds to antithrombin through a high affinity of pentasaccharide, which is found in almost a third of heparin molecules. For inhibition of thrombin, heparin must bind to both the coagulation enzyme and the antithrombin. even though inhibition of factor 10 is really not required for the binding to occur. The binding of heparin to both the coagulation enzyme and antithrombin induces a conformational change in the antithrombin. This actually enhances enzyme inhibition. If you look at the picture on your right, you will see the antithrombin and then you will also see factor 10, how they are coming together to actually make a binding. You also see thrombin as well. So please look at the picture, and it also explains just like the the scientific and the pharmacological, the way like the drug is actually working in the body. Stop. Yes, this means you. This slide talks about a contraindication of heparin. Heparin is contradicted in hypersensitivity, uncontrolled bleeding, and can also cause severe thrombocytopenia. Heparin should not be used with any products that contain benzyl alcohol in premature infants. So please stop right there. The next slide talks about the common dosage and route of heparin. Heparin can be given in various ways, such as subcutaneous, intramuscular, heparin lock, IV continuous drip. Heparin comes in numerous dosages. For example, intermediate bolus is 10,000 units, followed by 5,000 to 10,000 units every 4 to 6 hours. When it comes to subcutaneous, it can be given 5,000 units IV, followed by initial subcutaneous dose of 10,000 to 20,000 units. Then 8,000 to 10,000 units every 8 hours, or 15,000 to 20 units every 12 hours. So this is the reason why like heparin has like numerous ways that it can be given, because it goes all the way up to like 20,000 units. Let's talk about the pharmacokinetics of heparin. As you can see, there's also like a graph that shows like the peaks with regular heparin and also the NPH heparin. So like when it comes to pharmacokinetics, we talk about absorption. Heparin is mostly given through IV or subcutaneously. When it comes to distribution, heparin does not cross the placenta or enter breast milk. Heparin has a very high protein binding. When it comes to metabolism and excretion, it's probably removed by a reticular endothelium system. The half-life of heparin has a very short half-life of 1 to 2 hours. With increasing dosages. It's affected by obesity, renal and hepatic function, malignancy, presence of pulmonary embolism, and infection. If we also let's look at the routes, the onset and peak and duration of heparin sub-Q and heparin IV. The When it comes to heparin sub-Q, the onset is between 20 to 60 minutes. And then the peak is 2 hours. The duration is between 8 hours and 12 hours. So when we look at heparin IV, the onset is immediate. The peak is between 5 to 10 minutes, while the duration is 2 to 6 hours. The graph also shows the molecular weight of like basically a regular heparin and also like um a clear heparin. So please look at the graph and also like just observe a lot more about the graphs. And also when it comes to drugs, there is no perfect drugs. Every drug has its side effects or adverse effects, just like heparin. Some of the adverse effects of heparin includes alopecia, which is like a normal hair loss, rashes, hives. It basically induces hepatitis. Heparin could cause bleeding. It induces thrombocytopenia and anemia. Most of the time, when heparin is given as a as an IV or IV bolus, or injection, it can usually cause a lot of pain at the site. So it's very important for nurses to always, like, especially when they're giving like patients IV, they should always check the IV sites for any redness, warm, phlebitis, inflammation, because like all of this can also come from like one drugs. Heparin can also cause osteoporosis. It can also lead to fever or hypersensitivity reaction. So it's very important for us to really consider and pay attention to all of the side effects, because no matter what, like I said, there's no perfect drugs. Every drug has its side effects. So does heparin. Next slide talks about drugs and food interactions. Heparin should not be taken with many different type of drugs, or be taken with different types of food. So, for example, heparin should not be taken with aspirin, NSAIDs, or any of the penicillins family or dextrin, because all of this actually increases the risk of patient bleeding out. So it's really very important that when a patient is taking heparin, they should make sure they don't take like any NSAIDs or aspirin or penicillin, because like their chances of bleeding could be very, very high, especially with those two drug interaction. When it also comes to the food aspect, heparin should not be taken with caramel, garlic, ginger, donquay, feverfew, because all of this, like I said, also increase the chance of the patient always like just bleeding out, and that's basically what we don't want for the patient. If a patient is being given heparin, we should always make sure we question the patient, like what type of medication they are currently taking, to just like prevent the use of any like bleeding or hemorrhage or blood clot, because like I said, like foods and drugs can have, like, with their interactions, it can really cause a lot of more complications to the patient's health. Next slide is the antidote of heparin, or the antidotes to heparin. The antidote to heparin is protamine sulfate. So 1 milligram will neutralize roughly 100 units of heparin. This is basically how it works. Heparin is more like an acid, it's more acidic, and protamine sulfate is basic. So like basically when both of them are comes together, they actually it basically neutralize the drugs. It neutralize. So like when an acid and a base comes together, it becomes neutral. So that's basically what heparin and protamine sulfate does. Like when heparin and protamine sulfate comes together, it neutralizes the drug. So 1 milligrams will actually neutralize roughly 100 units of heparin. Slide is talks about nursing consideration. This slide is very important as all the other slides as well. When it comes to like the nurse giving out medication like heparin to a patient, it's very important for the nurse to assess the patient thoroughly, especially the patient's like mental status, and also like the patient's health status as well. So like when it comes to like after giving out heparin, it's always important for the nurses to assess for any signs of bleeding or hemorrhage, because like heparin could cause like bleeding on the gums, nose, it can cause nosebleed, unusual bruising, black tarry stool, hematuria, hematuria. And it's always important for also the nurse to monitor the platelet count every 2 to 3 days during therapy, because like mild thrombocytopenia, which usually occurs around like the fourth day, can also like cause like a really more complications to the patient's health. So that's why it's very important, like after giving a patient heparin, it's always important to assess the patient, to make sure the patient is okay, to make sure the patient is comfortable and there's no complications. Because like we're like when we're giving out drugs, like drugs like heparin to a patient, we are trying to like help the patient get better. We're not trying to like make the patient like add more complications to the patient's health. So it's very important as a nurse to always assess the patient, like to like check their vital signs, make sure like there's no bleeding in their stool, there's no like nosebleed, basically there's no like bruising and all of those. Like it's very important for a nurse to always assess a patient when they're giving out heparin. Nursing diagnosis and intervention. The nursing diagnosis involves risk for bleeding related to anticoagulation therapy for deep vein thrombosis, DVT. So like when it comes to the intervention, the intervention includes like before administering anticoagulant, assess the clotting profile of the client. Monitor the client closely for hemorrhage, especially in those at increased risk for bleeding. Monitor coagulation studies, including prothrombin time, INR, activated partial thromboplastin time, which is APTT, fibrin, degradation, split product, and platelet counts appropriately. So it's always important. So like this is actually just the nursing diagnosis and also the intervention. Based on my presentation, I would like to test your knowledge about how much you know about heparin from every single thing I've said from the beginning to the ending of the presentation. So I came up with an NCLEX question. So let's see, let me test your knowledge a little bit. So the question asks, which statements below best describe how heparin works as an anticoagulant? A. It inhibits clotting factor from synthesizing vitamin K. B. It inactivates the extrinsic pathways of coagulation. C. It prevents factor 10A from activating prothrombin to fibrogen. D. It enhances the activation of antithrombin 3, which prevents the activation of thrombin and the conversion of fibrogens to fibrin. So please take your time to answer this question. I mean, it's okay if you guess, but I just want to know how much, based on my presentation, you know so much about heparin. If your answer was D, yay, you're correct. It's the correct answer. Heparin enhances the activation of antithrombin 3, which prevents the activation of thrombin and then the conversion of fibrogens to fibrin. Therefore, this medication is indirectly inhibits thrombin via antithrombin 3. So if you get this question right, yay, that's good. It's really good. That basically means you know your information very well. But if you didn't get it right, it's okay. Sometimes it's good to guess anyways, because like by guessing, you can actually correct yourself and then know like why this answer is wrong or what else am I missing from the information. Or maybe I was not really clear about the mechanism of heparin. So please, if you get the answer wrong, it's okay. It's all right. It's always good to get something wrong and try to make up for it. All right. Slide just shows like video on heparin, which could be found on YouTube, because like sometimes like most people really like once like they actually hears about like a certain topic, like for example heparin, they really want to know so much more about the medication, and also like maybe they want to know like okay, what's what's the nursing responsibility, or maybe they just want to go know in great details about the medication in general, like for heparin in general. They might want to know so much about heparin in general. So it's always good to look at other sources. If maybe if one person is explaining the mechanism, or how does the drugs work in the body, or what's the drug it's all about. And then maybe they might not understand it from the person that is presenting. It's always good to look at other sources, because there's so many sources out there that basically explains um they might explain, like for example, they might explain heparin alone and you might get it right there. But then there's some other places, like for example, like you might listen to like someone else speak and you might not really understand or comprehend what that person is saying. So it's best to also hear it from someone else. So it's really good to just look at different sources just to learn more about the medication. Heparin is it's a really amazing drug. So it's really amazing. Yes, it has its side effects, but it's really amazing just to help actually prevent a lot of blood clot, because as we age, like a whole lot of like people usually get sick a whole lot, and it's really nice that we have all these medications that are they are helping us to get back to our normal stage of life, or our normal state, even though they might have some like little side effects or there, but it's better to have medication that will help your body get back to its normal stage than not to have a medication at all. So it's very important. Just please go out there, look at YouTube videos more about heparin. It talks about heparin a whole lot. I might not have gone into like a lot of details, but maybe many YouTube videos out there gives a great details about heparin. So please take your time to just watch videos on YouTube. There are different places, like read books about heparin. It might be very interesting. Like I said, it was a very amazing drug for me. Like I really love learning about it a whole lot. This is my references. Definitely, I couldn't have done this entire presentation if I actually didn't do my research well from different resources, like books, like I said, YouTube videos. Definitely this presentation wouldn't have happen if I didn't get ideas from other resources. So this is just my references where I got all of my information. Please, if you have chance, you can actually look it up and just to know like where I got all of this information from, because definitely they said it's really great to just get knowledge from other people as well, to know their own views. So I'm really grateful I was able to do this presentation, and I was able to get all of this information from other resources, which really helped me with my entire presentation. And I will really it's really always very important to also cite the people that are giving you all of this information. So all of this just shows my references, and I'm really happy I was able to do this presentation because I really learned a whole lot about heparin. And I hope and I wish to learn more about other drugs, because the more I get into like learning about all this different type of drugs, the more I become really like anxious to know so much more on how these drugs works in the body, because these drugs are amazing. It's really amazing how the connection with the drugs, and then the entire body system and how it works. And it's really amazing. Like, yes, we are not able to see it physically, but like a whole lot, like when you're taking this medication, a whole lot of stuff is happening in your body, and you're just not aware of it. The only time you're aware of it is like when you start seeing some side effects, which are not really good, but at least it shows that okay, the drugs is actually working. If you don't have any side effects, it's really good. That means it's still, I mean, as long as you're getting better, the drugs is making you better. It shows that the drugs is actually working inside your system. So it's really amazing to just learn about different drugs. And heparin was really one of the drug I was really fascinated by, and I'm so happy that I was able to learn a whole lot about it. So I really hope that you really enjoy my presentation. Thank you.